Hey, so I want to answer this question. You were asking about what's one thing I kind of want people to know regards to palliative care. So I'm Ruth, if you don't know already, I'm 31 years old and I live with life-limiting health conditions and I am under palliative care in the community. And I know you're thinking I look well and how can this girl be under palliative care? But she is. Right now she's fighting fungal sepsis and she has intestinal failure, Fowler syndrome, bladder failure. I'm a full-time wheelchair user. I have Addison's disease, Ehlers-Danlos syndrome, which has caused multiple complications, and other secondary conditions affecting my heart, my lungs, and just everywhere. Basically, my organs slowly kind of, getting worse. And there's not much we can do to stop it. And the treatments keep me alive, but they also cause multiple effects, which then affect my other organs and then affect my life and shorten my life. But yes, palliative care. What I think I'd like people to know is that palliative care and end-of-life care are different. End-of-life care is end-of-life care, literally months, weeks to live. Palliative care, you can be under palliative care for a number of years, for many years, and under hospice care as well for many years. And there's not one look for palliative care. You know, you can look well. You don't have to have tubes or lines to need palliative care. You might have tubes and lines and treatments. You might have no medical devices. That's not dependent on how ill you are, and that every patient is different, and that it's okay to talk about death. You know, there's dignity in birth, but there should be dignity in death as well. And it's okay to say no to treatments. It's okay to choose, to choose when to stop. Whether that's choosing to stop completely, whether that's choosing to stop invasive treatments, whether that's choosing to stop certain surgeries or certain treatments because of the side effects or because of what it does to you. You know, quality of life over quantity of life is something that I and my team are, focusing on. Sorry, this isn't really answering your question, I feel. Yeah, just that palliative care is on a spectrum, like lots of things, and to always listen to your patient and listen to them and their story. And even if you met another patient with exactly the same symptoms, exactly the same disease or condition, every patient is individual. And remembering it's about quality of life. Things like, I really want to get a tattoo. Is it sensible? Not really. But there's ways we can do it and minimise the risk, because I really want to get one. And I want to have one, and I want to do some matching ones with friends as well, so then they have them even when I'm not here anymore. And medically my team should be like, no, that's not sensible. But actually, when you look at it as a palliative patient, if you can manage the risks, then some things are worth doing. So I feel like I'm not really answering this question. I'm so tired. But yeah, I just, palliative care is not one look. And it's not someone lying in bed dying and old at 90 and like hardly talking and yes, this is my deathbed and I'm on the end of life care. And that palliative care can look glamorous, it can look sassy, it can look young, it can look going out, it can look so many different things. It changes day to day, but there's not one look, and every patient is individual, every patient has a story. And it's about symptom control for me. It's about quality of life. It's about saying I want treatments, but saying no to some really invasive treatments because they're not worth the risk and the side effects, and focusing on my quality of life and things that make me happy and bring me joy, alongside managing my symptoms and the progression of my conditions, and making sure I'm not in pain and suffering. That was my biggest fear, being in pain and suffering, and I feel really reassured that they're not going to let that happen. And talking about things that I want towards the end and things that matter to me, and being able to have those conversations. I don't want to upset my mum or dad or friends talking about really difficult subjects. So yeah, I hope that's answered some questions. I don't know if it has or not, but yeah, thank you for talking about it, and any other questions, just let me know.